Hi, my name is John Grisella, one of the co-founders of University Compounding Pharmacy. We'd like to take a few minutes and give you a tour of our compounding pharmacy. Please follow me. We have nothing but the highest quality vitamins and nutritional supplements. In addition, we have books on menopause, weight loss, and we have plenty of literature that we make for patients so they can read about the different conditions they have. We have a full weight loss department, and we are staffed by 2 certified nutritionists who spend full-time counseling patients and doing one-on-one consults to help make sure the patient is getting through the weight loss program in an efficient manner. Okay, we are now in our main compounding lab. This lab is different than the way compounding pharmacists used to make drugs years ago. It starts today with a formula. Every formula is checked and formulated by 2 pharmacists working together. We have over 18,000 formulas in our computer right now. Formulas that we don't have that need to be researched, we have a support group of 47 pharmacists throughout the United States and pharmaceutical chemists who assist us into getting the right formula together so that we can make an individual prescription for a patient. And some of the things that we may make for patients would be hormone replacement creams for men and women. We may make transdermal or topical pain relieving drugs for arthritis and sports injuries. We might even make a veterinary product for a cat or a dog or a child who has inability to take a dosage form by mouth because the tablets are too big for them or they don't taste good. There's pretty much anything we can make, and there isn't anything that we haven't been able to make as long as the chemicals are available. And then once the pharmacist gets the actual formula, then he works off this, and this is our assurance and your assurance that we're getting the right product. Everything is, like I said, custom made for the individual patient. This is where we make our topicals and our cosmeceuticals. One of the things that we found is there's a big demand for high quality cosmeceuticals to fight aging and wrinkles and sun damage. When we reviewed the literature, we found all the studies that were done on using vitamin C and retinoic acid and lipoic acid. And we duplicated these formulas so you get a high concentration of active ingredients, and it really does work well. And now we are in our capsule room, where all of our prescription drugs that are made in capsule form are made. For instance, we have estrogens over here that we're making. What he has over here is a capsule machine that you can make 300 capsules at a time. And the powders spread over to the capsule tray into individual holes, and it's unbelievable how accurate this will get. One of the most important things we do as a compounding pharmacy is have our products tested by an independent lab to make sure that you as a patient are getting exactly what it is a doctor prescribed. We're now in the call center and customer service department of University Compounding Pharmacy, which is one of the most important departments of the pharmacy. When we receive a prescription from the physician, either by fax or when they call it into our office, what we do at that point is try to contact the patient to get the information. It's important that we get the correct address, for one, get all their insurance information, because we do try to bill the insurance company. Sometimes they pay, sometimes they don't, but we at least attempt to bill the insurance company for the patient. We are now in the lab that prepares all the creams. As you can see, there's a lot going on here. For instance, right here we're making our cosmeceutical creams, and these are special bases so the patient is not allergic to the creams. It requires a lot of technology and pharmacist involvement in order to get the best possible base so that you can get active ingredients in there without having an allergic reaction. And then over here, as you can see, is some of our techs that are working on some of the different creams that we make also. We make a topical cream, like I said earlier, for treatment of pain and arthritis, where you just apply the cream right to your skin and you get relief instead of taking it by mouth and getting upset stomach. And this is also where we make a lot of our hormone creams. All of the hormone creams, again, they require special types of bases so they carry the drug right through the skin, into the bloodstream, and right to where you need it. So all of this requires high performance technology in order to get the best possible product so the patient gets the desired effect.
Thank you, doctor, for your order, and you'll have it about 2 days. Bye-bye.
This is the Drug Information Center here at University Compounding Pharmacy, and one of the departments that we're the most proud of. We are probably the only compounding pharmacy in the United States that has its own drug information pharmacy that is staffed by 2 full-time pharmacists who are working all day long answering telephone calls for patients and for physicians. Many times physicians who are having difficulty with the patient, or they're new to compounding prescription drugs, they have questions on how to formulate, how to dose, how to administer the drug to the patient. They call our pharmacists here at University Compounding, and we spend the time to work them through their problems so that the patient actually gets the best possible prescription for what their needs.